and I would request Dr. Swati Mahajan Madam, Dr. Jitendra Lade Sir and Dr. Sandeep Dabolkar Sir to chair the session. Now I would call Dr. Shraddha Karkamkar to present her paper. So next, Dr. Shilpi Agrawal. Dr. Sapna Parab. Dr. Hanif Khan.
Very good morning all. I am Dr. Hanif Khan. I will be presenting with the impact of the diabetes on the hearing. I will be going through the introduction, aims and methods, results and the discussion, and lastly the conclusion. As per WHO's 2021 stats, there are 540 million individuals with diagnosed with diabetes. The association of diabetes and the hearing impairment has been recognized over the years. However, existing literature reflects lack of consensus. Known complications of diabetes are neuropathy, cardiovascular disease and retinopathy, but hearing loss and tinnitus represent a significant but often overlooked complication that affects the quality of life. The main aim of the study is to quantify the prevalence of the sensorineural hearing loss among type 2 diabetes. But this is a cross-sectional study including 120 patients and the patients age were the 30 to 50 years. Patients were chosen and exclusion criteria were the patient with a conductive or mixed hearing loss and other causes of SN loss like trauma, infection, and patients are not willing for the testings. Data collection done by the PTA, pivotal audiometry, and the HbA1c levels. HbA1c levels are graded into like less than 7 is good control, 7 to 8% is moderate control, and more than 8 is pure control. Results of the study: among the 120 patients, like 80% has the hearing impairment and 40% has a normal hearing. Like HbA1c findings, more than 72 patients has a HbA1c level above 8 and below 7 have 32 and in between 7 to 8 are 16 patients. In my study, the prevalence rates of the hearing loss in uncontrolled group, that is more than 8, is 84%, and in the control group, that is less than 7, is 31%, and in between it is a 56%. Now the implications of the finding. The finding underscores the significant relationship between the elevated HbA1c levels and increase the hearing threshold, indicating that the poor glycemic control closely associated with the higher risk of SN loss. Conclusion. Like the main conclusion of the study is we need for the regular audiological evaluations. Like regular audiological evaluations are imperative for the diabetic patient, especially those with the elevated HbA1c, to monitor and address the potential auditory issue promptly. A study also concludes that the individual with more than 8 HbA1c shows significant higher auditory threshold. The alarming rates of the hearing loss among individuals with uncontrolled diabetes compel us to reconsider the traditional patient management approaches, integrating auditory assessment into routine care paradigms of the diabetes management. Yes. The further research, like looking forward, the further research is essential to elucidate the underlying mechanism and clinically tailor our practice for those impacted with the hearing loss. Yes. Yes, thank you.
I just wanted to know if you have considered the duration of diabetes mellitus in your study.
Yeah, actually I did the study, but I am not included in this PPT.
So did you find any significant?
Yes, ma'am. Duration more than 10 years we have more significant.
So what was more significant, the HbA1c levels or the duration?
Oh, ma'am, HbA1c level. Okay. Yeah. More than 8 is more significant, ma'am.
So so HbA1c is a better indicator
Yes,
of possibility of
Yeah.
SN loss.
Yes.
Is that what you're saying? Okay. Are there any other questions from anybody? Thank you, doctor.
Yes, thank you.